Hey everybody, welcome back to my channel. So today I wanted to talk to you guys about something totally different from hair and makeup. I kind of wanted to talk to you about something that I've kind of been going through and something that's kind of like affected me for some years now, but I've had nobody to talk to about it. And the people that I did talk to about it, they're like, what is that? What is going on? So which is nothing wrong with that, because everybody experiences things differently and has different stuff that goes on in their life. So yeah, I definitely wanted to talk to you guys about what's been going on with me and give you kind of like some solutions on if you feel like you have the same thing, what you should go do to get checked, basically. So let me start off by saying this is going to be very personal. So if you don't want to get into talking about menstrual cramps and menstrual periods, then you might want to leave. But if you know somebody that has really bad menstrual cramp, go ahead and watch this and hopefully learn something and give somebody else advice about this. Well, let me also start off by saying I am not a doctor. I've done my own research because I realized I was diagnosed with something and I wanted to know what my options were, what can I do to fix it, and how can I basically cure my body. So what I'm talking about, the mysterious thing that I have, basically I was diagnosed in October of last year with a disorder called endometriosis. Now I'm gonna pause. Do I hear crickets? Do I hear anything? Well, let me go ahead and tell you this again. The word is endometriosis. And after a lot of research that I've done, I've seen that it claims millions and millions of women have this disorder. But I've only found one person that had the same surgery as me, and that's it. Like, nobody else knows what I'm talking about. Everybody thinks I'm just weird, and I'm not gonna say weird, but just like, okay, I don't have that problem. So basically, let me read to you what endometriosis, what it is, and basically how it can affect you. So, sorry, I should have had this up and ready. So basically, endometriosis is a female health disorder that occurs when the cells from the lining of the wound, meaning your uterus, grows in other places of the body. This can lead to painful, irregular bleeding and problems getting pregnant. Let me go ahead and read you the side effects of endometriosis. And it's crazy because it is common that women who have endometriosis don't even know it. So unlike me, I had really bad side effects that weren't really named on here, but as I started doing more research, I'm like, somebody needs to tell me, like, I'm going to diagnose myself. This is what I have and I know it. And of course the doctor diagnosed me because they're like, yeah, this is what you have. So the symptoms of endometriosis do include very painful menstrual cramps. Pain may get worse over time. Chronic pain in lower back or pelvis. Painful bowel movements or painful urination during menstrual cycles. Spotting or bleeding between menstrual cycles. Fatigue, infertility or not being able to get pregnant. Constipation, bloating, nausea, especially during your menstrual cycle. So the pain that I was having, I felt like I've always had really bad menstrual cramps, but they seemed to, over time, they were like getting worse and worse and worse. And I mean, when they got to the point where I would bloat to the point, like my stomach would bloat so big, like I looked like I was about 4 months pregnant. And I'm about 119, 120 pounds. So bloating that big. And of course, as you can see, these pictures on the side definitely show you how bloated I would get. Like, it was so bad. And when I say it was so painful, my cramps were in the front as well as in the back. So it would be so bad. I just felt like in the front, somebody was stabbing me with a warm knife. In the back, I felt like somebody was taking a rake, like how you rake your leaves, and just clawing me. And this would go on for 3 days constant. The pain did not go away. It was so severe. Like, it wasn't like the pain would come and go. It was literally like, I'm staying with you all day long for the next 3 days, knowing your cycle goes for 7 days, but I'm gonna stay with you for the first 3 days. It does affect my job, of course, because nobody can be out of work who can just randomly be like, okay, I'm missing 3 days of work because my cycle's this bad. You tell people that and they're like, what? Like, There's no way. Like, it can't be that bad. No. When I say it's bad, I mean, I was in pain, and I didn't understand why nobody else got it. Like, I had some girlfriends say, oh no, I don't cramp, or I do cramp, but it's very light, it's not that bad. No, mine were bad. When you start to vomit, when you start to pass out for no reason because the pain is so bad, there's a problem. Like, there's a serious problem. Well, I kind of been letting time go by because I felt like no one took me serious. Nobody offered me anything except for like birth control. And I'm like, something's wrong with me. Like, everybody thought it was funny because my stomach got so big, and like, I couldn't suck it in. Like, you could poke it, it was hard. And I think people just thought it was funny. And I'm like, this isn't normal. Somebody help me. So, like I said, I was diagnosed in October of 2013, and it is now September of 2014. And I ended up looking for a doctor. I said, I'm only gonna find a doctor that specializes with endometriosis. Thank you, I finally found one here. And his name is Dr. Olivero. He specializes in endometriosis. I went to go visit him. Nice guy. Like, he was like, so who told you had endometriosis? I showed him the paperwork. Basically, he was like, have you ever had a laparoscopy surgery? Have I ever had laparoscopy surgery? I said, no, I had surgery when I was 9 years old over some stuff that happened with my ovaries, but no, I've never had a laparoscopy, basically. And he's like, you know, I want to go ahead and investigate and make sure that you do have endometriosis, because it looks like with your stomach bloating that big, since you did have surgery when you were so young, let's go ahead and take a look and see what's going on now that you're older. And so I'm like, yeah, let's do it. I'm ready to go. Like, when you've been in pain for so long, from the time you started your cycle, which I started mine at 14 until 27, like, I don't even know how. What I said was, I can't live like this no more. That's exactly what I said. So we went ahead, and my surgery was September 16th. But on September 15th, you have to, of course, do a surgery prep. And if you know what a surgery prep is, you know where I'm going with this. So, of course, you see a split screen. I have the stuff that you're supposed to drink, which is magnesium caltrate. And it basically cleanses your body, so when you go into surgery, there's like nothing floating around. You can have liquids, clear liquids, but you can't eat anything for 24 hours. And also too, my surgery was on Tuesday at like 3:30. So yeah, I can only have clear liquids. Well, I didn't know, like, I didn't eat after Sunday. I didn't know that I could have clear liquids on Monday. So I didn't have anything. So when I got to the hospital, I was super dehydrated. So yeah, they of course pumped me with all this fluid. And on Tuesday, I get to the hospital, and I'm like, when I say nervous, I was super nervous. And they took my blood pressure, and my blood pressure was so high because, well, I'm not gonna say so high, but it was high for me. And they're like the guy was like, he was like, whoa. I was like, oh. He was like, you must have saw my face. I said, yeah, I'm just nervous, basically. So yeah, as they're hauling me off to surgery, I'm like, bye mom, bye to my boyfriend, bye to her boyfriend. And I'm like, I'm ready to do this. Although I'm super nervous, I'm ready. And I just remember the doctor looking over at me, and she's like, Nora's a nurse, she's like, are you starting to get tired? And I'm like, no, I'm good. Like, ain't nothing kicking in. Man, after that, gone. I was knocked out. So after the surgery, a laparoscopy surgery is supposed to last about 45 minutes to an hour. Mine lasted an hour and 30 minutes because of all the stuff that he found, the endometriosis, the scar tissue. He had to get rid of all that. He had to laser all that stuff out. And as you can see, this video on the side as well is me after the surgery. And I can see that hole, that's my belly button ring. I don't know why that hole is so big, but yeah, that's my belly button ring, so don't mind that. Just look at the bandages. So the bandages are showing you where they cut me at, and they're basically, they go through your, a laparoscopy surgery is, they go through your belly button, and they cut you on two sides. They're like quarter-size scars, and they go in there, and that's how they laser everything out. They suck everything out of there. And that's what they did. And I just remember waking up and screaming because my surgery lasted an hour and 30 minutes, and because he had so much work to do, and I had so much scar tissue. So yeah, he got rid of everything. I swear he wiped out my whole period as well. So I was like, oh, I'm not complaining. Well, I guess I woke up and I was in so much pain. I just remember screaming, I'm in pain, I'm in pain. And of course they knocked me out again. And I just remember saying that. And I ended up, a laparoscopy, like a surgery, it literally like an in and out patient thing type of deal. But since my pain was so severe, they made me stay overnight. And I don't even remember, like, apparently I was talking to people, and I swear I don't remember anything. So I wake up in the hospital the next morning. I'm like, why am I still here? Like, how come I'm not at home in my bed that I made? And yeah, the nurses there were fantastic. My doctor are fantastic. His whole team is like fantastic. I could not ask for a better team. And the next morning he came in with his staff and they talked to me and they let me know what was going on. They said by next visit they're gonna go over pictures with me. I mean, I'm telling you, I had the best like medication at the time because like I said, my pain was so high. I mean, my legs were like getting this weird massage. I had my back, I said my back was hurting. They gave me, a heating pad. I had patches all over me, these things in my nose because I guess I stopped breathing, or I was losing oxygen during the surgery. Like I was like chilling. And yeah, like I said, the surgery went well, but he did want to talk to me about his findings, of course. So after that surgery, and actually after that surgery, you're supposed to rest for a week and you're supposed to be up and about because it's actually not that invasive. Like, it's not that bad. I felt like my blood pressure was too high, and I still felt like I was in a lot of pain because of all the stuff. I kind of felt like they pumped me with a lot of stuff, and I was really swollen. I was like, I'm not going in there with like swollen ankles, swollen feet. My legs are swollen. My belly's still big. I'm not going into work like that. I was actually out for 2 weeks, and it was the best 2 weeks of my life. It gave me time to recover. It gave me time to kind of think about what he told me, because I had another visit a week later, which was on September 23rd, where they go in and make sure everything's healing correctly. And of course it is. Like, you would never know that I had surgery. But yeah, he just told me, he showed me the pictures. I was extremely disgusted. His team came in and showed me all that, and I'm like, how do y'all look at this every single day? Like, But yeah, he showed me the pictures. He went over everything with me. And yeah, basically what happens is, the solution to my problem is I can never have a period. And another thing would be my fallopian tubes on my right hand side, they're not connected. My fallopian tube and my ovary are not connected at all. Like, I don't know how that happened. And then the left side of my fallopian tubes and ovaries is inflamed because it had so much stuff on it. Endometriosis, scar tissue was on there, that he really had to do a lot of work over there. So I don't know if they're damaged. He did tell me that I can have children. I would need help having children, basically. So basically they would have to implant the egg and implant the sperm in my uterus. And another thing that's crazy about me is my uterus wall is so thick that I would have to get on birth control for it to thin. So I can have children, but it's gonna be very hard. I was sitting there and they're like, why do you look so sad? I'm like, my ovaries aren't connected to my fallopian tubes. Like, who wouldn't be sad? And it sucks because I do have 3 other sisters and they all have children but me. So of course it does kind of hit me a little bit harder because I'm like, what's wrong with me? Like, why did I have to get this? But endometriosis, whatever this is, I would not wish this on my worst enemy. Like, it's bad. So and the women who don't have symptoms, I feel bad for them because you don't know what's wrong with you. Like, I always felt fatigue even when I wasn't on my period. Like, I always felt like something was always wrong with me. And so I don't know. At the end of the day, I am so happy I got a laparoscopy surgery. I'm so happy for Dr. Olivero. I'm so happy for his team. His team was amazing. But let me go ahead and get to the solution. So never have a period again, because endometriosis comes back and scar tissue comes back. So for me, in order to postpone it, I can never have a period again. So I went out and for my issue, I was only recommended 3 options: the pill, the patch, or the NuvaRing. And I'm not really like a pill person. I take my vitamins, but I've always been like, since high school when I had to be on the patch, I was like, no, I can deal with the patch better than anything. So I did go ahead and move forward with the patch, which this is the generic brand of the Ortho Evra patch. And I'm not afraid of this patch. I don't smoke. I do not drink a lot. I don't smoke at all. So I guess that can contribute to like clotting and stuff, like leg clots if you smoke. So I'm pretty healthy outside of having this disorder. So yeah, I did go ahead and move forward with the patch. The thing about the patch is it has a lot of estrogen in it, which can help with the lining of my uterus and thinning it out. But having a lot of estrogen, I don't know what kind of side effects I'm gonna have. But like I said, when I was on the patch when I was younger, it didn't bother me. Like the first couple of days I felt fatigue, and then I'm out, ready to go. After you have the surgery, this is what you can't do. So you have to avoid driving for 24 hours. You have to keep everything covered with the little bandages they had. If they would have gave me Spider-Man bandages, it would have been on. Like I probably would have been the happiest camper ever. But anyways, you can eat, you could drink like tea, eat broth. I probably wouldn't say for me, because I think I just dive back into food. Don't dive back into food. Take it slow. Get like some Jello. I don't eat Jello, but get like something that's light on your stomach, because they did just go in there and mess stuff, up a little bit. So yeah, they did give me a lot of medication, so I was on a lot of medication. You can't shower until the next day after your surgery. And you also have to make a follow-up appointment. So that's basically after the laparoscopy surgery. Now, when to call the doctor. If you have a temperature above 100.4 degrees with chills, which I was shaking in the hospital with chills, so I know that's the reason why they kept me, because I was screaming before they knocked me out. Your pain persists after taking the medication. It just gets worse. And if you have any type of vaginal bleeding, Dr. Olivero wiped out my whole period, and I couldn't thank him enough, so I'm good. If you still have nausea and vomiting 48 hours after the surgery, your incisions become red, or they become swelling, or you have drainage out of them, which I didn't have that. I think my body heals pretty good. So yeah, I didn't really have any side effects. The only thing I could say was I was very swollen. I was nauseous. I did vomit, but the laparoscopy surgery was literally the best thing that has happened to me. I haven't had, because it's only September 26th, I have not had a period yet. Like I said, I can't have a period, but I haven't did the patches long enough to know what it's like to basically skip a period. So hopefully I'm just normal in the way I am now. I will do an updated video after I've been using the patch for about 3 months, and let you know what's going on. If you guys want to see that video, go ahead and thumbs up this video and leave a comment down below. And if you're having any type of symptoms that I named here, or if you're just having any concerns about your menstrual cycle or about having children, I would seriously recommend going to see a doctor immediately, because no one knows your body the way you know your body. And everybody just laughing at me and telling me, this is normal, or there's really nothing we can do about it. I will never believe anybody again, and I will never go this long without having somebody else get a second opinion to research what's going on with me. So I highly recommend seeing a OBGYN, or just, I don't know, going to see a specialist to make sure that you're okay, if you do feel like you're having similar symptoms. Also too, I know they do like a lot of case studies. I feel like I'm just not a lab rat, and at first I almost got so desperate to the point where I'm like, I'm super sick, maybe I'll just become a lab rat and a guinea pig and let them kind of investigate what's going on with me. But after doing my own research and being proactive throughout this whole thing and finding Dr. Olivero and his team, that he's gonna be my doctor forever until anything happens. Like, he will be with me forever, and hopefully one day I can have children. But yeah, I'm just saying, I am so happy that I got this surgery. I will do a 3-month update if you guys want me to. Still talking about the surgery and how I feel these days, so I will definitely do that for you guys. Don't forget to thumbs up this video, subscribe to my channel, and until my next video, I will talk to you guys later. Bye.